says the stream is live.
All right, perfect. And we're live. Hello, everyone. My name is Tim Mikilishvili, CEO of Amadev Pharma, also host of the Medical Innovation Olympics, a fourth annual global, fully virtual competition with a very unique format. This is a celebration. This is a party where we are getting together innovators from various different fields in healthcare that don't normally interact, but that can accelerate innovation, which we need so urgently today, because healthcare is a subject of a lot of controversy, a lot of limitations lately across the globe. In order to fuel that innovation, I think we need to have events where we are excited to contribute, to judge, to receive feedback from a lot of industry leaders, two of whom I have with me today. John Hemming and Bart Zoni. Okay, so I would like to ask them to introduce themselves. They're quite familiar with this event. I think that a lot of people are hearing about it, but more need to know about what we do at the Innovation Olympics. John and Bart,
Well,
great to
shall I
have you
go
here.
first? Yeah, I've done various things. I've been in tech for a long time. When I was 23, I set up a tech company which I sold when I was 59. And I've been involved in politics as well. I was for 18 years. I was a member of Birmingham City Council, which is in the centre of the UK, England, and I was deputy leader of the council for a year. And I was a member of Parliament representing part of Birmingham Yardley, for 10 years. And after I sold my business, I'm also a jazz musician. And after I sold my business, I got into biohacking. And so I've got heavily involved in trying to work out how to influence cells. I'm trying to reverse balding with some success. And obviously working in the sort of world of genetics and splicing, actually. I'm particularly focused on splicing these days, as well as epigenetics. So I was very pleased to participate as a competitor last year. And I make a simple point. If you've got a new idea that you want to promote, then this is an event for you, because you need to decide why not to participate. It's something you can do online, so you can fit it in around everything else. So that's important. And basically, it gives you an opportunity to have your idea discussed and your idea to compete with other people's ideas. So it's a very good opportunity, an opportunity not to be missed.
Yeah, thank you. Thank you for a great intro there. Bart, please introduce yourself and talk a little bit about your view of these.
Sure. I mean, one of the great things is I've had the honor of being a founder a few times. I know how hard that is, and also working in instances where companies have taken those innovations to market and been very successful. And as a founder, there are limited resources out there, and there's competition for resources, but that competition isn't as collegial as what Tim's doing here, where you get to hear how people are presenting and thinking about life sciences, the ways that these innovations are coming along and becoming businesses. And frankly, the connections that I've made over the last 2 years have been very fruitful and interesting, met a lot of really cool people. And as a founder, you need to know people. And this is a great way to make that happen in a forum where everybody's friendly, everybody's positive. You get a lot of great feedback that's going to make you more competitive out there. And that's really what we need. So as a founder, you really got to go forward for this.
Yeah, I introduced Amadev Pharma just very briefly there, but this is an analytics agency that brings together the transparency of sports and the precision of data science. And one of the ways we do that is through this event, where we open it up to consultants, to innovators, to researchers, pharma companies, biotech. One of the traditions that we have is to always feature an Olympic athlete, an Olympic gold medalist, which we've done for 3 years, some of whom also interact with healthcare, and in fact, quite frequently with type 1 diabetes, patient advocate. We've had Gary Hall Jr., as well as Bob Beeman, who talked about a number of different conditions he had last year and how he's a champion in healthcare. Earlier this year at the JPM Morgan, I talked about this event, this global event, and its caliber and its track record. And I asked for some testimony from some of the expert judges, right, from you both, as well as Bob. And instead of providing me with a written statement, he chose to actually offer a recording. And I want to share that with the team, with the audience here who's watching very quickly.
Long jump since 1968. I was a key. Hello, everyone. This is Bob Beamon, the Olympic gold medalist and current Olympic record holder in the long jump since 1968. I was a keynote speaker at Amadea Pharma's third annual Medical Affairs Innovation Olympics last year. And when Tim asked me for a quote to be used for his 5-minute pitch, I instead offered him to introduce myself to express how strongly I felt and believed in the power of taking a combination of sports and healthcare to the next dimension, which is demonstrating at Amadea Pharma. As I have gotten to know him, it is clear to me that he is not only a fan of sports, but he is deeply respects and understands the value of what being a sports athlete means. And this is why I joined Tim to rally for your support of his company movement, as I always have been around the best competitors from an early age, which helped me succeed and break records in sports. And his event provides healthcare innovators with just that kind of opportunity today's competitive and complex industry requires to compete with the best, be more resilient, and become leaders in their field.
So that certainly brings some great memories, I think. So we had the honor and of having our winners also come back and present their ideas in the finals in front of the Olympic gold medalists, Gary Hall Jr. And Bob Beamon, who's actually listening on audio. And so those of you who are watching, you have a chance to not only receive recognition and networking, but also potentially, if you advance that far, to present and receive some recognition from Olympians as well. Now, some important dates you have to remember, okay, which you may see here in the ticker below. We have 3 weeks remaining until you can register. For early bird pricing ends July 31st. Okay, we have the second session of the Olympic trials as well. That starts September 1st through the 12th. Okay, where you will have a chance to present. You'll have 5 minutes to present your kind of concept or product. Okay, in front of the expert judges. You'll receive the voting and feedback in real time as well. And so that's how we are celebrating competition and feedback as well, which is very important for you to consider. Now, I want to play a second clip in terms of another expert judge here, an investor, Chris Piedmont, who talks about why you should attend and who should attend. But before I run, I share that clip. Bart, John, what have you seen in the first session of the Olympic trials, and what are you looking for in terms of innovation today in this event? We have 6 innovation tracks, as you remember, right? Maybe talk a little bit about what you're looking for, what kind of ideas or some general tips to those who are thinking about this.
In the end, there are lots of situations where people's health is not as good as it could be. And we're looking for how we can improve people's quality of life, because there are quite a few challenges there. So there's such a broad area. My own team is getting very, very focused on ALS, which in the UK is called MND. But there's so many different areas. And there are areas where no progress has been made and progress needs to be made.
Mm-hmm. What I noticed and really appreciated was there was a laser focus to what John just said on the patient and an understanding of where those needs are, and then really novel ways to address that. So we saw everything from technologies that haven't existed to very practical solutions that just connect dots that haven't been connected before. And seeing the different domains of innovation that are out there that can actually help has really been exciting. And innovation doesn't mean a new molecule. It could just be a manufacturing solution that connects somebody who needs a device with a device when and where they need it. So seeing all the range of ideas that were submitted and discussed was very exciting.
Yeah. And since you've mentioned them, here they are. Here are our leaders after the first session. Okay. And these are the titles of their ideas. You'll notice we've had submissions in medtech, concept, another concept in drug for immunosuppression drugs, cyclosporin, device, diagnostic concept, again, that's targeting chronic kidney disease, and a medtech product as well, ready for deployment as well, skin AI platform designed to detect skin cancers. Now, some of you may be watching this and may be thinking, well, should this be the format? Should this be the event where I need to, submit this idea that I've been kind of hesitating about who to share it with? And so that's why I'm going to play a few clips here, okay, that are going to address some of the questions you may have. And I also want to invite those of you watching to ask questions here as well.
You don't have to have a PhD. You don't have to have 10 years of business experience.
Yeah.
Okay. If you have something you think is worthwhile pursuing in your heart, that you say, I think I can create value. I think I can do good here. I think I can, build something that will help people and obviously potentially make a lot of money along the way as well. Show up, apply. Most ideas don't do well in a vacuum. I can tell you from my own personal experience, there are some people I've been working with, quite frankly, for some of them for years, that are, for whatever reason, reticent to engage others. And it may be a fear of being criticized. It may be a belief that they already understand and fully have a sense of what they need to do and why they're doing it. But you'll find in both cases you're probably wrong. Engaging in conversation with people, particularly people that will push back on you, that will make you explain things, that will ask you to justify something that perhaps maybe you hadn't even considered, will strengthen your position and allow you to do a better job of developing whatever the concept of the product or service that you're bringing to market. That competition, that pushing back, is essential to having a good solution. I think I said to someone the other day, when I present an idea for something into a group of people and everyone says, Chris, that's great, let's do that, I get very nervous because nobody's pushing back on me to expose the flaws in what I'm saying or what I'm thinking about. And there are flaws. There are absolutely flaws. Yeah. So as much as entrepreneurs need encouragement to overcome the challenges, because it's, once again, another subject, it's a challenging thing to do. And it can be quite stressful, and even some people can call it depressing. The pushback is necessary to refine and strengthen what you're doing, and without it, you will not have a complete, robust, potentially even successful solution as you would be with it. These Olympics are a place to get that.
Yeah, and this is why I call this a very intense competition. What are some of your comments, Bart? You mentioned you're a founder multiple times, right? How important is really challenging yourself in being innovative and really making those leaps, right?
Well, the last place you want to get stumped is a pitch that the stakes are high. If you're in a situation where you're pitching or you're in a business meeting and you're like close to the finish line and somebody asks you a question you don't have a good answer for, it's the worst timing for it, right? So getting reps in for people that have been through it, know what the questions are like, know what the challenges are like, and getting that practice and building muscle memory, super important. So when you're in that situation, you've done it a million times. I mean, think about, there's no high jumper in the world that's run up to the bar for the first time in the Olympics. That's not the way that it works. And
Right.
and this is a fantastic training ground because sure, it's tense, but it's a venue where the stakes, what's the worst thing that happens? You make some new friends. You know, and when the stakes are like that, it's so worth doing.
Yeah. Oh yeah. I mean, I'm currently working with a pharmaceutical company on a project where I involved one of our prior winners, whom I got to know through this event. So, a lot of people ask me, so Tim, you're a busy guy. You run a consulting agency. You're now a tech company. Why do you do this event? Right. And what do you get out of it? Right. And it's a way to give back to the community, but it's really those relationships. I myself would probably not been able to meet you, John, right, and really gotten exposed to the amazing talent that you both have to share, and insights and network also, had I not started this event. So I speak from my own perspective, to tell you, look, if you see this post, connect with the expert judges. It's really a no-brainer. This is a very unique opportunity. And the thing is, yes, it is intense, but it's also at your leisure and on demand. All right. The most intense and probably well-attended part of the event is the opening ceremony, where we want you to take some time aside and reflect, because innovation also needs reflection. Right? You need to kind of sometimes take yourself away from what you've been doing. Even, let's say, the same home office that you've been doing the same tasks. Try to, go outside in your backyard. Take your laptop there. Maybe and go in the daylight, maybe in the morning. Maybe you'll be a little bit more innovative. That's the same idea. We have generated a lot of learning, through the content we've developed, and we've had, and some of the, I'll play some of these clips today, maybe next week as well. Every week you'll be hearing more about this event. So yeah, that's just some of my kind of gratitude to you, both of you, and to just really being great for the network that we've created. And so the more competitors, the more people get to know each other and challenge themselves and be prepared also. This it's a training ground. And so on that note, Bart, I know that you and the expert judges are also offering mentorship to the winners. And so I'll play that clip here. And you're offering some private mentorship time, as well as Bart Zoni, another investor, executive in pharma, to the winners, right?
Am I absolutely correct? Yeah, and I got to say,
yeah. So, Bart, anything you'd like to add there?
Well, sure. I'm after kind of being in biopharma, the agency life is all about communication, right? And so, sometimes the skill set of storytelling and the skill set of science innovation don't all come together. And so sometimes folks have a lot of information, a lot of passion, but not a story. And when it's your information, everything's important. And sometimes you get 5 minutes to convince somebody. So just taking a little bit of time with somebody who isn't invested the way that you are, who can work with you and hear and kind of understand what matters and help coach you in terms of how to package that into a story that's persuasive and compelling to somebody who doesn't know anything about what you're doing, is very helpful. And this is something that I've personally done a long time. I know a lot of the other judges have done, and why not, right? It's the kind of thing that if you can get somebody to bounce some ideas off who's done it before and maybe pull one nugget or one phrase or one thing that changes the way that you present, it could be worth everything, you know. And my hope is some or all of the folks that participate in this, we're watching these innovations enter the market and make a difference sometime later in the future.
Yeah. Oh yeah. And in fact, we have a very strong track record of that, of previous winners as well. There are prizes. I do want to also remind you, it's a competition after all, right? So there's two $5,000 prizes that Amadev Pharma will be awarding to the top concept or product. All right. So I talked about the prizes with Chris Piedmont as well. I'm going to play that clip here as well in terms of his view of the value proposition here.
Certainly $5,000 is nothing to ignore, but we all know it's going to take far, far more than that for many of these ventures to succeed. The value you're going to get out of this is the recognition and the help. It's worth 10, maybe 100 times, that cash prize. But you've got to show up, you got to participate, you got to be here. And I would even say that participating in itself has high value. You're going to learn a lot. You're going to meet a lot of people. Even if you don't, get through the entire competition, even if you don't win that first place $5,000 prize, plenty of value to be gotten along the way. And I encourage anybody who's thinking about doing something in this space that's innovative, or is in the process of bringing something out and will be soon taking it to market, or has, potentially already taken it to market, but maybe struggling a little bit. Attendance here will have tremendous value.
Yeah. So I think it's it's an important point, which we talked about here today. Now, so 8 hours, one-on-one free mentorship to the top 2 winners. All right. There's a lot of learning that's taking place, as we talked about. And I want to share one clip from one of my favorite panels from last year, New Ways to Lead in Medical Affairs. Okay, 3 different perspectives that were provided. So I'm going to share that here as well right now.
It was a great work of art. But I really want to kick us off by talking about what it means to lead and lead well for what our organization needs.
Finally, today is actually Customer Experience Day, the International Customer Experience Day, and that is another key aspect for organizations and for leadership. And I'm not just talking about our external customers, I also mean our internal customers. And this is often not considered that broadly as it should do. We are often very outward facing, but we need to be inward facing in order to be good at outward facing.
One of the challenges I've always seen when talking with people in medical affairs is it's not always clear what is their objective, what are they being measured by, what are they trying to achieve. And I think getting that clearly stated and known to the team is essential to success in that area. Beyond that, the other shortcoming I've always seen in leadership in medical affairs is making sure that the teams are properly resourced. It is very detrimental to take a team, give them a clear
Okay, let me. Are you having technical?
I think the clip stopped.
Oh, it stopped. Okay. Let's see.
Team is essential to success in that area. Beyond that, the other shortcoming I've always seen in leadership in medical affairs is making sure that the teams are properly resourced. It is very detrimental to take a team, give them a clear vision and a timeline and a set of objectives to.
All right, we're running into some technical issues. That's okay. Well, as you can probably appreciate from some of the spirit of those comments there, we're quite candid and we don't hesitate to address topics head on at this event. All right. I mean, that was one of the comments you had made, John, that this is where you debate freely.
Yeah, there's no downside really. You don't learn from people who you agree with. You only learn from people who disagree with you or have got questions, and there's no downside.
Yeah. Great. Well, so I'll share with you all of the details you need. Again, 3 weeks left until the games, until the registration ends. Okay, for early bird pricing. Here are some of our speakers you'll hear from. Again, professionals, students, interns, fellows. Our themes are those concepts and products that will advance the access, continuity, and quality of healthcare. These are our 6 innovation tracks. Okay, so we're looking for more competitors, more courageous competitors and innovators. Marketing and medical affairs is where we have not yet received enough submissions. So we have Bart Zoni here, who's a marketing executive. And we have a lot of medical affairs leaders as well, who are among our expert judges. So this is a special call to those leaders there who have new ideas in marketing, right? Nowadays, both of these functions are having to integrate technology, AI, digital transformation into their workflows, right? And so it's very critical to understand how to do that best and to be still innovative and demonstrate how that talent, that particular specialized talent in terms of marketing, which is very analytical, as well as medical affairs, can be taken to the next level. All right. So, John, as we wrap up here, what are some of the final thoughts?
Sign up straight away. There's no downside. And if you're signing up quickly before the 31st of July, there's an early bird benefit, isn't there?
Yeah, absolutely. Yeah.
Whether it's on is it the end of the 31st of July? So August is higher, or somewhere during the day.
Right. Yeah. End of July 31st. Yeah.
Right.
Absolutely.
Eastern
and so here I want to share with you some of the certificates and some of prior winners. All right. Here are, okay, just there we go. So here's our last year's winner, for example. Okay. In phage therapy. Silver medalist. Right, bronze medal, John Hemming. So in patient centricity category. So you were a competitor last year and you're an expert judge this year, which is amazing. We have many other special recognitions. So even if you're not able to win the $5,000 prizes, which Mark Armstrong actually did, but he also won the other special recognition in most active ideator. We had a David Barzilai, a longevity expert, globally renowned as well. These are all the different types of recognitions that you will be able to receive and compete for. We had the MedTech category also again last year, which Mark Armstrong won, as well as active ideators amongst the judges even, right? Silver medalist here, Pierre Daou. All right, long jump champion. We had the bronze medalist from Greece. This is a global event, by the way. Okay, as I mentioned, we've had competitors from Africa as well. I'm sharing with you the 2023 gold medalists. All right, Tamar Sapir, who's been invited to the Memorial Sloan Kettering, Mahek Chaturpati as well, Field Medical. So these are some of the faces and names of previous winners that you will be able to join, all right, and also earn these certificates, which will be posted across social media channels. Okay, Yair Saperstein won our inaugural event. He won the bronze medal there. his company, AvoMD, has now implemented their clinical decision support into major guidelines in the United States, major professional medical associations, such as American Heart Association. Okay. So we have Sylvia Carter from Roche, who was a bronze medal winner last year as well. So we've had pharma competitors as well. So very, very wide diversity of backgrounds amongst previous winners. So I want to add that, end this promotional session on that note. Okay, on the winning note, those are the winners whom you can join. Look out for the comment for the details to register. Thank you very much. Thank you, John.
Thank you.